So you have a private practice and one of your patients asks you to do an evaluation for immigration. What do you do? As mental health professionals, we all understand what dual relationships mean and what constitutes a dual relationship. So evaluating a person that you've been treating for psychotherapy, that means that you already have a therapeutic relationship with that person. So shifting to a different role, that of an evaluator with the same person, definitely constitutes a dual relationship. For example, USCIS will send a letter to the applicant saying that they did not submit enough evidence to verify their hardship. And in that letter, it specifically says, well, we received a report by Dr. So-and-so. However, we do not give a lot of weight to that report because you have not demonstrated that you've established an ongoing therapeutic relationship with that doctor. And here's where this dilemma comes in. It's not about establishing a therapeutic relationship. If you are a professional who's been trained on how to answer a psycholegal question, you do not need to have an ongoing relationship in order for you to know how to assess that question and how to answer it, basically. So it's for that reason that I include a little footnote on all of my reports explaining the difference between an ongoing therapeutic relationship with a psychotherapy patient versus a forensic evaluation that answers a psycholegal question. And I think that's really important to include in your reports, hopefully to avoid these requests for more evidence. Now, sometimes we will do an evaluation and then the attorney refers the client back to us either for some treatment or for an addendum, for example, to the report because they were requested to submit more evidence. Now, that's a little bit different. Number one, if it is one of those addendums that you're there to do, usually it involves kind of an update between the last time that you saw the person and when they're coming in today. And you comment on the changes that happened in their life, how they've impacted them, and their current symptoms and how they're doing currently. Now, if they're sending them to you for therapy, for example, that's a little bit trickier. It looks good on paper when a person is in treatment. But us as mental health professionals know that we all know how many psychotherapists it takes to change a light bulb, right? It takes only one. The light bulb has to want to change. So if you're getting somebody that's coming to you for therapy, but all they really need is a letter saying that they are in therapy, it's not enjoyable. It's not work that we spent years learning how to do. So I am personally opposed to that. Now, a person that is really struggling and wants to continue with therapy after an evaluation, that is a different story. In my practice, I have the luxury of having several other mental health providers, and in general, we tend to refer to other mental health providers within my practice. But I have seen patients that I evaluated for immigration, and I continued seeing them, and that was more of a crisis management situation. So for example, I did a VAWA, and I continued seeing that client because she was really, really struggling with the end of that marriage. I saw her for maybe 5 or 6 times. She got better and she felt she didn't need therapy anymore. So that I felt comfortable with. I felt it was my responsibility at a time when she didn't have access to many other providers. She did not want to go over her story over again because it was re-traumatizing. I felt that she was in need and that it was appropriate for me to treat her. Now, sometimes I will be treating a client who is involved in immigration proceedings and they need a letter, they need something that shows that they are in treatment. Now, that's different from a psychological evaluation. That would be referred to as an affidavit, for example. So in that letter, you will write whatever the attorney is really asking you to write, in the sense that you don't want to include any irrelevant information that's not necessary. So if the attorney is asking you, it would be really helpful for you to comment on the main themes of your work together and how she is evolving and what her prognosis is, if she needs further therapy or if she's good to go. And if you can include a diagnosis, that would be great. So I feel comfortable doing that, of course, as long as my client allows me to do that. I don't have to disclose very detailed information, just as long as you convey a general sense of the type of work that you're doing and how they're doing in terms of progressing and needing further treatment. So that's called an affidavit, and any treating therapist can do that. Well, I hope this has been helpful, and if you have any other questions, feel free to put them in the comments below. Also, see the link to our website that's in the description, where you can see all the other trainings that we offer, including some upcoming free trainings.